Welcome to this informational presentation regarding the Emory DPT evaluation form. The purpose of this presentation is twofold. First, we want to give you background on our program that will assist you in providing your PT student with a fulfilling internship experience. And secondly, the information and tools for how to effectively evaluate and assess their performance with our online evaluation form. This presentation will take you through an introduction to the form and its purpose, the objectives of the internship, and the details of how and when to complete the evaluation and of the evaluation conference afterwards. First, for an introduction, why we are committed to using this evaluation form. We are often asked the question, why does Emory use this particular form? It's so different from the forms used by other programs. The simple answer is that this specific form assures that our students are evaluated on the core competencies that we value and teach. Unlike many other DPT programs, our program is competency-based, and we have identified 6 competencies that each of our students must master: provision of patient care, interpersonal communication, teaching learning process, administration, research, and consultation. All 6 competencies are taught and integrated throughout the curriculum by using a problem-solving approach and process. For example, our faculty model problem-solving, interpersonal communication, and teaching learning processes during formal and informal interactions. Similarly, students are expected to demonstrate competency using the problem-solving process during provision of patient care, interpersonal communications, the teaching learning process, and administration in both the classroom and clinic setting. We feel that this evaluation form effectively evaluates our students' problem-solving and competency within 4 of our 6 competency areas: provision of patient care, interpersonal communication, teaching learning process, and administration. Additionally, we feel that this evaluation form effectively addresses the objectives and mission of our DPT program and of the internship experience. Objectives. What are our objectives for the internship? We have 6 specific objectives for the internship. During and upon completion of the internship, the student will, first, use the problem-solving process to assess patients and provide an appropriate plan of care. Second, provide appropriate therapeutic services. Third, use interpersonal communications and the teaching learning process in interactions with patients, families, and other professionals. Fourth, actively recognize the rights and dignity of the individual while planning and administering care plans. Fifth, participate in the planning, implementation, and evaluation of the teaching learning process. And lastly, participate in the administrative responsibilities required of a physical therapist in the clinic, such as patient care documentation, billing, and scheduling staff. So now that you have a bit of background about why we use this evaluation form and what we want our students to learn during the internship, allow us to give you the tools to effectively evaluate and assess your students' performance and knowledge. The following section will discuss the information contained within the online evaluation form and will guide you through the process of how and when you should start and complete the evaluation. First, who completes the evaluation form? The form is completed independently online by both the clinical instructor and the student. If a second clinical instructor has been working with the student, the second clinical instructor reviews and completes the form in collaboration with the primary clinical instructor. Secondly, when should you and your student complete the form? Evaluations are completed twice during the 10-week internship. The first evaluation is to be done midway through the affiliation period, at approximately 5 weeks, and should assess the student's performance based on weeks 1 through 5. The second evaluation should be completed at the end of the affiliation period and should assess the student's performance based on weeks 6 through 10. To reiterate, each evaluation should assess the student's performance based on his or her performance during only the immediately preceding 5 weeks. Third, how do you actually fill out the form, and what type of information can you find within the form's contents? The form is comprised of 4 of our competencies: provision of patient care, interpersonal communication, teaching learning process, and administration. Each competency section is comprised of objectives or component behaviors, which are defined by specific criteria. Where to find the criteria will be discussed on slide 12, and these are important, as you will assess your student based on whether or not he or she performs the objectives and behavior to these criteria. Let us go to the next slide for a specific example of the objectives and behaviors. So this is a screenshot of one of the pages on our evaluation form. At the top left, you will see the competency title, in this case, provision of patient care. On the bottom left, you will notice in blue highlighted text the objectives and behaviors that comprise the competency. To find the specific criteria that define these objectives and behaviors, let us go to the next slide. On this slide, you see on the left a copy of slide 11 with the provision of patient care competency and its objectives. When you click on the blue highlighted text of the objectives, a pop-up window will appear with definitions or criteria for the individual objectives and behavior. This is the information, i.e. the criteria, that you will need in order to assess the student's performance on the individual objectives and behavior. So now that you've accessed the form and have found the location of the criteria for the objectives, how do you actually go about scoring the student? For most items, and there are a few exceptions which we'll address in future slides, you will score the student a yes if he or she has demonstrated the behavior to criteria during 80% of opportunities over the preceding 5 weeks. The student should receive a no if he or she failed to demonstrate the behavior to criteria on 80% of opportunities over the preceding 5 weeks. If this is the case, please record the estimated percentage of time that the student did perform the behavior to criteria. An NA is applicable if any of the following scenarios exist. You have not observed the student on a behavior. The student has not had the opportunity to perform a behavior. Or, thirdly, you feel that the number of times you have observed the behavior yields insufficient data to rate the student. So, for example, if you've only observed a specific behavior 2 or 3 times, you may feel uncomfortable scoring the student's performance on that behavior. In this case, and not applicable would be appropriate. This is a screenshot of one of our form's pages. Note the column in which you score the student. The arrow is reminding you that if you scored the student a no on a specific objective, that you should indicate the actual percentage that you have observed the behavior to criteria. So again, for example, if your student performed an objective to criteria on 55% of opportunities, they would still receive a no in the scoring due to it being less than 80%. However, you would record the 55% in this area with the arrow. Now, we're going to talk a bit about 4 items that are exceptions to the typical scoring procedure. The first 2 items are items number 16 and number 40, which address patient safety and professional behavior. On the evaluation form, you will notice that these items are scored first, due to their importance in patient care and professional behavior. In order for the student to score a yes on these two items, he or she must meet criteria on 100% of opportunities over the preceding 5 weeks. A no score is appropriate if the student has failed to demonstrate the behavior to criteria on 100% of opportunities. If the student scores a no on either of these items, the directors of our clinical education program, Dr. Patricia Bridges and Dr. Tammy Phillips, should be notified immediately. Their phone numbers are located here. The following two slides are screenshots of items number 16, patient safety, and item number 40, professional behavior, along with the reminder that the student must score 100% for a yes on these items. Here's number 40, demonstrate professional behavior. Our second scoring exception addresses items number 7 and number 13, which relate to patient examination and therapeutic interventions. In order to score these two items a yes or a no, the instructor must first keep a record of the specific procedures that the student has performed. Specific examination and treatment procedures may be found on the form pages titled Examination Procedures and Therapeutic Interventions, which will be shown on the following two slides. Every time the student performs one of these specific procedures, he or she should be scored a yes or a no based on whether or not the procedure was done to criteria. Unlike the criteria for all other behaviors and objectives within the form, which may be found through the pop-up window described in slide 12, criteria for these specific procedures may be found in the Emory Physical Therapy Entry-Level Competencies and Criteria Manual, which is located at your facility. This is a screenshot of the examination procedures form within the evaluation. Please note in the gray highlighted box the reminder that the criteria for the below specific procedures may be found within the Emory Physical Therapy Entry Levels Competencies and Criteria Manual at your facility. And this is a screenshot of the therapeutic interventions form within the evaluation. Again, the gray highlighted text reminds you that the criteria for these specific interventions may be found in the manual at your facility. So now that you've collected data on the specific examination and treatment procedures, you can go about scoring the student on items number 7 and number 13. In order to find the overall score for these two items, you will divide the total number of specific procedures that were performed to criteria, or scored a yes, by the total number of procedures performed and scored a yes or a no. Items rated an NA should not be factored into the total number of procedures. A yes for items number 7 or number 13 should be scored when the student demonstrated procedures to criteria during 80% of opportunities over the preceding 5 weeks. A no should be scored for failure to demonstrate procedures to criteria on 80% of opportunities over the preceding 5 weeks. An NA would occur in any of the following scenarios. You have not observed the specific examination or treatment procedures, or the student hasn't had the opportunity either to perform these procedures at all or to perform them a significant number of times to warrant a rating. The next couple of slides address a few general tips and resources for when you start the evaluation form. First, you may start and stop completion of the form at any time, as it will automatically save your work unless you hit submit. Please do not hit the Submit button until after the evaluation conference with your student, which will be addressed in slides 24 through 27. You may re-enter the form at any time to edit, add, or delete information. If your facility requires a hard copy of the evaluation, you will need to print each page individually by either hitting the Control P key or by selecting Print from the File menu. And again, please do not hit the Submit button until after you've held the evaluation conference with your student. For resources and to access all of the information that you may need to review prior to completing the evaluation, remember this slide, slide number 23. If you would like to review an entire competency, you may click on the below links. So any of these links will lead you to an entire competency. To find the criteria for the objectives and behaviors within a competency, you may click on the blue highlighted text to retrieve a pop-up window with the criteria listed. Please review slide 12 if necessary. And lastly, to find the criteria for specific examination or intervention procedures, please use your Emory Physical Therapy Entry Levels Competencies and Criteria Manual, which again is located at your facility. So I am going to click here on the teaching learning process. You see that there's a link. So it's going to open up a new browser in my internet, new browser window. And so here you see the entire competency and the teaching learning process, which gives you all of the objectives and behaviors within this competency. So when I'm done reviewing, I can close the window and go back into my evaluation. This last section highlights the evaluation conference and all that should take place during and after this review with your student. After independently completing the evaluation, the instructor and student should meet to review their forms. Differences in responses are discussed, and examples are given to substantiate the chosen response. If agreement is reached, the response is changed to the agreed upon choice. If disagreement remains, responses on each form should remain. However, indicate the difference within the comments section. Upon completion of the review, both the student and CI should electronically sign the form. The CI needs to indicate their specialty and if they are an APTA credentialed CI. And again, please only press Submit only after completion of the above steps. After the conference and submission of the evaluation form, discuss with your student the APTA Physical Therapy Student Evaluation, Clinical Experience and Clinical Instruction form, which is an evaluation form the student has completed on his or her experience at your facility. A few facts about this APTA form are as follows. The student will complete the form online and print a hard copy to review with you. After the student reviews this form with you, you must sign the form. It is important for you to realize that your signature does not necessarily denote agreement with the evaluation. It only indicates that you have received the feedback. This evaluation will be kept confidential and kept in a locked file at Emory in accordance with the Commission for Accreditation for Physical Therapy Education guidelines. Data from this APTA form may be used in the aggregate for Emory DPT's accreditation purposes, and it may also be used to assist in developing and mentoring clinical instructors and clinical facilities for our clinical education program. The signed APTA form must be mailed to Miss Bridget Moore, Administrative Assistant for Clinical Education, at the conclusion of the review and the student's internship. You may find Emory DPT's mailing address on this slide or on the next slide, slide 28. Finally, you are done and have successfully completed the Emory DPT evaluation and review process. This is the time to wish your student a heartfelt and hearty farewell to a very well-equipped and prepared, thanks to your efforts, DPT student. Well done! Our hope is that you feel empowered and able to complete the online form with confidence, and that you have a better understanding of the objectives of our DPT program and of the internship. For additional questions, please do not hesitate to contact our Directors of Clinical Education, Dr. Patricia Bridges and Dr. Tammy Phillips. Thank you for taking the time to review this presentation and for your support of Emory's DPT program and students. We are very appreciative of your time and efforts, and we value you as an important member of our clinical education team. Until we meet again, take care.